Hello, everyone. I'm Mary Beth Marsden, and welcome to GBMC's Greater Living. Let me just first say that I hope that all of you watching right now are healthy and in a safe space. But if you're not for some reason, and it has to do with your living situation and what you may be facing, we are here for the next hour to hopefully help you. We're going to be talking about something that is not necessarily COVID-19 related, but actually could have a big effect on the program because of the coronavirus, and that is the SAFE program at GBMC. And if you haven't heard of it, we are joined now by the clinical program manager, Laura Clary, who joins us to talk all about what SAFE is, what it means, and the great work that they've been doing and continue to do even through this pandemic. Laura, thank you so much for being with us.
Thank you for having me.
For people who haven't heard, or for people who may really just need to hear, tell us what SAFE is.
So SAFE stands for Sexual Assault Forensic Examination.
It's such a specific title, but it's so much more than that, isn't it?
It is. So it's actually not just something that we do and an exam that we perform, but the SAFE program actually is a program that provides a wide variety of services for patients who may have been victimized by sexual violence or domestic violence or child abuse.
Let's talk about how you define sexual assault as opposed to sexual abuse, or are they very closely intertwined?
So they are pretty closely intertwined. With sexual assault. There's a lot of different ways to define it, but typically we are referring to any type of sexual contact or behaviors that occur without the explicit consent of the victim. It differs from sexual abuse a bit, whereas sexual abuse, we are normally referring to vulnerable populations that cannot consent, such as children or people with disabilities or the elderly population. So oftentimes with abuse, say for children, we see that the perpetrator is somebody who lives in the home, a family member, somebody who has temporary or permanent care and custody over the child, whether that be, again, a family member, a teacher, or a coach. And with our older population, so for someone who's living in a nursing home or a residential facility, it could be somebody that works there that's actually their abuser. And what makes these terms different is the fact that sexual assault is not a mandated report. So when a patient comes in, they have the right to decide whether or not they want to report to authorities, whereas sexual abuse, as a healthcare provider, I am legally obligated to report that to the proper authorities because as a healthcare provider, it's my job to protect those that really need protected.
Laura, we are in extraordinary times right now, situation I don't think anyone in the world has ever experienced before to this degree, certainly not in this country for sure. What went through your mind as soon as you heard about not only the social distancing, but really the orders to stay home?
So the first thing that went through my mind is the fact that there are so many people that are going to be stuck in their home with their abuser without a way to get somewhere safely, specifically children. Right now, schools are closed, and oftentimes we see kids that are disclosing to their guidance counselors or their school resource officers, or they go to school and they tell their best friend, who then goes and tells a trusted adult. So now these kids are stuck at home and they don't have anyone to disclose to, and we know that oftentimes their abuser actually lives in the home with them.
Yeah, that's pretty scary. I'm sure that you and your team have had to think, okay, how are we going to now serve our population that might be in really great need right now? What have you had to do that's sort of outside the box thinking, that's different, or just being able to reach out?
So first and foremost, we wanted to make sure everybody knew that we were still available 24/7, 365 days a year. No matter what, we are always ready to respond to the hospital when a patient comes in that needs our services. We have kind of modified our workflow a bit so that patients can bypass the emergency room, because right now the emergency room can be a very scary place for someone to come into because of everyone being afraid of being exposed to the virus. So our goal is to keep healthy people hospital out of the emergency department. So we've altered our workflow a bit, working very closely with our partners in law enforcement to ensure that when we have advance notice, they can bring victims directly to our unit. We can do a pre-screening over the phone, and then we can provide all of their care in our private unit, again, separate from the ER. And then we can call over to the ER and do a telehealth medical screening with a medical provider when needed.
When did you realize that people would be frightened to come into the ER? Did you just start to see a drop-off?
It wasn't necessarily that we saw a drop off, but it's when we started seeing the tents going up outside the ER, which can be very scary to somebody who's not used to seeing that, which is all of us. Even us working in healthcare, it can look very scary. So we know that if it's something weird for us to see and we work in this field, then it's definitely scary for someone who has never seen anything like this before.
So for right now, for you guys and for your patients, the telephone is a lifeline.
It is. Yes. So we are available by phone. We have a confidential voicemail that patients can call and leave us a voicemail and we can get back to them. They can call our emergency department, which is 24/7. And then if they go to our webpage, we also have a lot of other resources and hotlines that they can call, where they man those hotlines 24/7.
So part of this interview, obviously, is a way to get the word out. We've been flashing the number up on the screen. I would suggest if you are watching right now and you see that number and you think that someone maybe could use it, please jot it down and pass it along. But what else are you doing, Laura, to try and just get that outreach going?
So you're going to hear a little bit more about our outreach initiative later on in this Facebook Live, but things that we've done recently to make our program more accessible is updating our webpage. So we wanted to make our webpage a lot easier to be navigated by all age groups. So you can go in and find lots of different services that we offer. Additionally, we have uploaded 2 animated videos that basically walk a victim through the process and what to expect when they come to the hospital. We found that by speaking with our community partners, especially our high school and college age patients that are coming in, seeing something via video is a lot more receptive to them. So we developed these videos with that in mind so that someone can watch these 1.5-minute videos and have an idea about what to expect when they come to the hospital.
If someone is watching right now and they think maybe their situation isn't quite abusive yet, but it's leaning that way. I mean, people are under a great deal of stress right now. They've been home for a long time. Maybe they've lost their jobs. Maybe they're trying to juggle childcare. Any number of things could be happening. What should people be looking out for? What are some of the early red flags? And what should they do if they haven't quite picked up the phone yet, but they're scared?
So again, there's a lot of different things that people can look for. And a lot of times we see this as a cycle where the violence will start off as something a little bit milder, maybe not physical initially, but then we see it escalate, especially in times of stress like this when people are stuck under one roof or there's financial strain, there's childcare strain. All of that puts additional stress on the family as a whole. So if they start to see little things happening, verbal abuse, being called names, if you do need to leave the house to get groceries, but you're not allowed to, or controlling finances, we see this type of stuff happen, and then we often see it escalate. You have to everybody is an individual. You have to decide what's the safest route for them. So whether it be going online and finding a resource that you can reach out to via the computer or a hotline that you can call, or again, just phoning in to our program just to ask questions to get support or to speak with an advocate, we're here for you.
I was thinking about the children. Obviously, it's hard for them to reach out and get help. And oftentimes it's a school teacher who notices something is amiss. Those teachers right now are not able to see those kids. It's killing them. I know it is. But if you were to talk to teachers right now who might be watching, who've been doing the online classes, who've been trying to reach out to the students in their classroom, is there something that they should be looking out for? Or is there a way that these teachers can use certain language to check in with maybe a child they feel might be at risk?
So I would say if you notice that a child is not participating in the online learning, or you notice things that maybe are off during the online learning, if you notice that there's maybe a change in their personality, we partner very closely with Maryland Center for School Safety, who has a confidential tip line that is available to be called in 24/7. So you can actually, the teacher can call in that tip line if they have any kind of concern, or if a family member has a concern, or a friend or another student even in on that chat has a concern. They can go to that tip line, make that anonymous report, so that people, it puts it on their radar and they can look into it. And you can also find that tip line information on our webpage.
Who are the people at the other end of the line?
So Maryland Center for School Safety their line is manned 24/7. A lot of the people that man the line have law enforcement background.
Okay. Sexual assault. We've talked about, reaching out if you're a victim. What about for those people, and I'm sure you've had many that you know of, who are struggling with the after effects of sexual assault, particularly now when their routines have been disrupted, when maybe their anxiety has been heightened? What advice do you have for them?
So we always tell our patients that you're not alone, and we are here to help you. Again, they can call in and speak with one of our victim advocates that are available. If they don't get a victim advocate on the line immediately, they can leave a confidential voicemail, and we will check that voicemail a couple times a day and can leave a safe phone number, and we can call them back to speak with them. Our advocacy partners within the community, Turnaround for one, who's one of our closest partners, they are also still available, and their information is available on our webpage as well. So we will help to connect that patient with Turnaround, who can assist in more long-term counseling that patient might be needing.
Laura, I don't want to put you on the spot, and I don't know if you have the numbers in front of you, but I know SAFE has been around for a while. Can you just talk about what the statistics are when it comes to abuse and sexual assault, at least in this area?
So the statistics kind of vary depending on where you're looking, but according to RAINN, which is a national organization, statistics show that every 73 seconds, someone in America is sexually assaulted. So we do find that women are victimized at a much higher rate, with about 1 in 6 women being a victim of sexual violence at some point in their lifetime. But men can also be victims as well. And I feel like there is still a stigma surrounding male sexual assault, that men can't be raped, and that we just know that that's not true. Oftentimes men don't come forward, or they delay coming forward. So we may not be capturing them in our numbers. So our goal at GBMC Safe is to really create an inclusive environment for anybody that is seeking treatment. So we know that these crimes don't discriminate based on race or gender or age, and we want all of our patients to know that they're safe and they're welcomed here in our program.
And that's so important, because I would think that if you're a victim, the forensic side of things, and maybe even the legal side of things, is very frightening to go through. And you're the first line, you're the first people they see who are really going to try and figure out exactly what happened or gather evidence. How has that changed over the years? How has the sensitivity surrounding that changed? How has the chain of evidence become tighter and better? Can you talk about that a little bit?
Sure. So over the years, I feel like with the amount of outreach that we've done, our numbers have actually quadrupled at GBMC. So we're seeing a lot more people coming forward. Our program is staffed 24/7 with certified forensic nurse examiners that are all trained to care for both pediatric victims as well as adult victims of sexual violence. So when someone has been a victim, if it's within the time frame, which we typically say is around 5 to 7 days, when they come in, we can actually perform the evidentiary collection, where we collect evidence from their body, we take photographs of any injuries that we see, and then we write up an extensive report. And all of this goes along with the super important medical treatment that we're also providing, and giving medications to prevent against sexually transmitted infection and pregnancy prophylaxis. We do tell patients that while you do have 5 days to come in for this exam, we recommend coming in sooner than later, because everything that you do can potentially disrupt evidence that may be on your body that we want to collect. So the sooner you get to us, the better. But we will see patients up to 5 days post-assault.
You know, it's interesting when you talk about the numbers quadrupling, and normally this would not be good news, but to you, it's actually the one positive that you can take away is that maybe more people are coming forward because probably the abuse and the sexual assault has always been there.
Right. We do think that it's just more people knowing about the services that we're offering and the fact that we've expanded our services over the years. So we didn't always care for children. So that's a population that we saw that we were missing in our community. So we decided to expand the services that we provided so that we could accommodate children under the age of 12 as well. So now we're getting those victims in as well as our older patients, our domestic violence patients, and now expanding to our human trafficking patients as well.
So I think it's pretty certain that COVID-19 is going to change our lives in ways that maybe we haven't even realized yet. And I'm just wondering from your perspective and from your career, what you think is going to happen. I know I'm asking you to make a prediction, but maybe what you fear is going to happen, or do you think that you'll have an influx after the stay-at-home orders have been lifted, or just how do you think this is going to change things?
I think what you said is correct. I think we're going to see a gigantic influx of patients once schools open back up, once colleges open back up and restaurants open back up. I do feel like we're going to see an influx in patients, but we're prepared for that. And again, we're always going to be here for whenever anyone needs us. And we always have the nurses and advocates ready for them.
Well, thank you for that confidence, and thank you for what you're doing during this time, because you're putting yourself out there too, and it is most appreciated. You had the good fortune of hanging out with my colleague Don Scott for a little while, I know, and this was pre-COVID-19, pre-coronavirus, I guess early February at some point, before social distancing became a thing, and you gave him a tour of the SAFE unit, right?
Yes, our brand new SAFE unit.